Hi everyone, welcome to my channel. Today we're gonna learn about heart block. Okay, so here we'll be talking about only AV nodal block, although we can have SC nodal block as well. SC nodal block means SC node is not working, so it's not able to generate the rhythm. That means there will not be any rhythm generated from SC node. That means there will be initially there will be no heartbeat, and after that AV node will take the role, and AV nodal rate you can see in the ECG. So that will be SC nodal block, right? So lesser or slower heart rate you can see then. Here we'll be talking about in this video about AV nodal block. So it can be of two type: incomplete heart block and complete heart block. In incomplete heart block we can have a first degree heart block, second degree heart block. Complete heart block, there is third degree heart block. So let's see what happens in this. So first degree heart block is whenever there is every time the atrial impulse is able to transmit to ventricle. So we can have always P and QRS ratio same 1:1. But what is the difference is there is some delay in the conduction here in between atria and ventricle. So the beat they takes more time, and whenever the beats takes more time, what that mean to you is there is change in PR interval. So PR interval increases. The normal PR interval is 0.12 to 0.16 second. So if the PR interval is more than 0.2 second in the ECG, that means it's first degree heart block. Okay, coming to second degree heart block, which is when the P and QRS ratio is not 1:1. That means there are some impulses, few impulses, which are not transmitted from atria to ventricle because of AV nodal problem, AV nodal block, right? So here there are some few beats are missing, like 2:1, 3:1, it can be there. That means some impulses are not traveling to ventricle. In this you must have heard wenckeback phenomena. What is that? Wenckeback phenomena is when there is subsequent increase in PR interval till a point when QRS is mixed. That means there will be increasing order of PR interval, and at a time till what time there is no QRS complex, and this is not in a regular interval. The same you can see here. PR interval is increasing bit to bit, and next till a point where there is no QRS complex, right? So this is second degree heart block. Last is third degree heart block, when atrial and ventricle rates are not matching at all. Atria at their rhythm and ventricle at their rhythm, so they are not able to conduct the every P wave is not followed by QRS complex, right? So total irregular rhythm. So here you should know one thing, that if the P wave is not transmitted to ventricle, if that happens, then ventricle start taking this role, and they are able to generate the rhythm. Yes, at slower rate, this is less than 40 beats per minute. So that rhythm is called idioventricle rhythm. And since ventricles are basically escaping the atrial rhythm, so that is called ventricular escape. You might have heard in viva questions, or sometime in amphibian physiology you might have heard these words. So ventricle escape is when this you can see ventricle rhythm. There are P waves as well, but they are not transmitted to ventricles, and that's why ventricles start beating, and this rhythm is called idioventricular rhythm. Okay, in this same third degree heart block you might have heard Stokes-Adams syndrome, where what happens is third degree heart block, because this is beating with a ventricular rhythm only, very less heart rate, so that leads to hypotension, decrease in BP, and which lead to decrease in blood perfusion of brain, right? So because of decreased brain perfusion, there can be multiple episodes of fainting or syncope episodes, and if this happens more than 1 minute, then unconsciousness, convulsions, and death can occur. Okay, so this is all about heart block. You can comment below if you want any other applied aspects as well. Thank you so much. Happy learning. Bye bye.